So next topic is the registrations issues in nursing. So first one is the torts. So what is torts? It is nothing but it is a harm or injury to a person or property or rights for which the injured party can seek compensation or damages in a civil court. So torts, these are the types of torts. It is intentional torts, unintentional torts and quasi-intentional torts. So this intentional torts is again divided into assault, battery and false imprisonment. So again unintentional torts is divided into negligence and malpractice. So intentional torts, that is assault. What is assault? It is nothing but harming the patient or beating or hitting the patient under significant fear. Example like physical assault. So what is battery? Battery is nothing but touching the patient's body without consent from patient. Example slapping, pushing, pinching or pulling. False imprisonment is nothing but not sending the patient to meet his family members or friends. Unintentional thoughts. Intentional thoughts and unintentional thoughts is the difference. Intentional thoughts is nothing but they will have the intentions to harm the patient, but in unintentional thoughts they won't have the intention to harm the patients. It is negligence or malpractice. Negligence, what type of negligence? Like not caring the patient timely or giving reasons or not monitoring the patient's temperature, pulse rate. This comes under the negligence. Next is malpractice. So nurse willingly or knowingly does something harm to the patient. Example, transfusion of blood to wrong patient. So next tort is the quasi-international tort, intentional tort. It is divided into two types: invasion of privacy or defamation of character. In invasion of privacy, as the name suggests, that the interference in the privacy or the personal matters. So the patient doesn't want anyone to interfere in his or her family or personal matters. Or in the other way, you can say that releasing patient's information to anyone without his or her consent. So next is defamation of character. As the name suggests, defamation is that which helps this reputation. So releasing false information about patient's character which affects his reputation. Maybe in that it says the two types, that is slander or libel. Slander, when the information is being defamated in the verbal information, then it is known as slander. Libel, when it is been written, then it is known as libel. So informed consent, it is very important. Informed consent, as the name suggests, that informed consent is nothing but the consent is been taken before informing. Means that the consent is been taken of the patient